Good evening. This is Lisa Guerra with a news bulletin before tonight's scheduled Nantucket Pulse COVID-19 Impacts to the Island episode. Massachusetts Governor Charlie Baker just mapped out a plan to offer financial support to individuals like the self-employed, independent contractors and gig workers who are outside the coverage of traditional unemployment insurance. This plan, called Pandemic Unemployment Assistance, or PUA, has up until now been a vague part of the federal government's CARES Act. Now information about how it will work has become clearer. Starting April 30th, the PUA will begin processing claims that will offer up to 39 weeks of unemployment benefits to the aforementioned individuals. Currently, they will not be able to claim benefits through the Commonwealth's Unemployment Insurance online system. Officials have not yet released the name of the vendor that will process these claims. Please note that the PUA can retroactively award benefits as far back as February 2nd or the first week the claimant was out of work, whichever date is later. In addition to updates to the PUA, the CARES Act created a program called Pandemic Emergency Unemployment Compensation, or PEUC. That offers a 13-week extension to those who have exhausted their previous unemployment benefits. The first valid week for a claim is the one starting on March 29th, and the last week is the one ending on December 26, 2020. For the latest updates about unemployment insurance, please visit the link appearing on your screen and in the description. And now here's your host, Roberto Santamaria.
Good evening. I'm Roberto Santamaria, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital's Community Health Initiative. This is a special edition of Nantucket Pulse programming that will air weekly covering coronavirus impacts for the island and will provide urgent updates as they unfold. The Centers for Disease Control has identified several studies that show individuals can feel completely healthy when infected with the pandemic's form of the coronavirus. Others feel fine only in the beginning of their bout with the virus. Both groups can easily infect other people. For this reason, the CDC is advising everyone to wear cloth face masks in places when it is difficult to practice social distancing, like in the grocery store. You may have the virus and not know it. A cloth mask reduces the travel of infectious droplets from your nose and mouth. The CDC advises avoiding medical-grade masks like the N95. Those are in short supplies and are desperately needed by healthcare workers. One of the biggest provisions of Congress's Coronavirus Aid, Relief, and Economic Security, or the CARES Act, is the boost to unemployment insurance. It expands the definition of unemployment to include furloughed workers, increased by up to $600 the weekly benefits to its recipients, added 13 weeks of additional benefits to those who have exhausted the regular unemployment compensation, and more. The state has created the first-in-the-nation collaboration amongst health organizations, government offices, and public health college students to track the contacts and whereabouts of those that tested positive for COVID-19. Called the COVID-19 Community Tracing Collaborative, it will produce valuable data about the spread of the virus by deploying over 1,000 contact tracers throughout the Commonwealth. We spoke to them Thursday morning, and they offered to remain on standby for us. Since we do not have that many cases on the island, we do not need their help at this time. The Department of Public Health just convened a meeting with medical experts from all over the Commonwealth, including the preeminent medical academic institutions, to draft a voluntary guideline to maximize the ethical, equitable, and efficient treatment of patients when resources are limited. It addresses topics like the quantity of medical equipment, distribution of resources, transparency, barriers to care, and other topics. To read the complete guideline, please visit the link at the bottom of your screen and in the description. The Commonwealth also sent an $800 million infusion into Mass Health to support healthcare providers. This payment comes on top of the $550 million in accelerated funding sent to providers in March. The new money pays for 20% rate increase of COVID-19 care and a 7.5% increase for all other care. It also gives extra funding to programs like personal care attendants, community health centers, adult day health, behavioral health centers, and more. The Department of Public Health and the National Guard have expanded their rapid COVID-19 testing program at nursing homes. Since the program's beginning last week, they have administered over 1,300 tests. For more information about testing and other pandemic-related resources available to those in Massachusetts nursing homes, please call 617-660-5399 between 9 a.m. and 5 p.m. 7 days a week. On Wednesday, Governor Baker filed legislation to protect healthcare workers from liability and suits due to COVID-19 related care. Lieutenant Governor Karen Polito supported the decision, saying, quote, "Massachusetts is blessed to be home to some of the world's best healthcare workers and institutions. And it's important that the fear of liability does not prevent them from delivering the kind of medical response we need during this pandemic." End quote. All grocery stores in Massachusetts must now restrict the number of customers allowed in the store to 40% of their maximum occupancy. Stores with a maximum of 25 people or less are exempt. In response, the Mid-Island Stop and Shop has closed the Pleasant Street entrance so they can keep account of all the customers entering in the other entrance. Stop and Shop released a public statement to NCTV today saying, quote, "To better enable associates and customers to practice social distancing, Stop and Shop has limited the number of people at our stores in Massachusetts and will comply with the new state requirements. Customer counts in each store will be limited to a specific number based on the square footage of the store. A store associate is stationed at the entrance monitoring customer counts to ensure that the proper capacity is maintained. Periodic in-store announcements will also be made about the capacity limits. We have taped on the floors at each register so customers understand the 6-foot distance they should keep from others, as well as signage and reminders for customers in our in-store radio broadcasts. Plexiglass shields have been installed at every register as an added protection for our cashiers. The aisles are one-way traffic only across the entire store. Signage is provided to inform customers of this shopping pattern, and directional arrows are placed at the top and bottom of each aisle. We are strongly encouraging the use of masks among all associates. We're procuring N95 masks for our store associates that will be delivered next week. We have been ensuring our associates continue to have access to items like disinfecting wipes, gloves, and hand sanitizers to use at work to help keep themselves and customers healthy. Our associates are also conducting hand washing at more frequent intervals, as well as using hand sanitizer on a regular basis." End quote. Currently, all food establishment workers are required to wear face masks. Not every Stop and Shop employee fits that designation, only those that work in departments like the bakery and deli. The Board of Health cannot require everyone to wear masks. It is a civil liberties issue. On April 3rd, the governor signed Chapter 53 of the Acts of 2020. This offered flexibility to localities experiencing pressure from the pandemic and the numerous statewide closures. 3 of the Act's provisions are of particular interest to the town of Nantucket. Section 10A allows the town to push back the property tax deadline exemptions and deferrals from May 1st to June 1st. Section 11 allows the town to waive excise tax, real estate tax, and betterment assessment interest and late penalties until June 30th. This only applies to bills due March 10th or later. This week, the Select Board voted to take full advantage of these provisions. The ferries continue to operate at reduced schedules until further notice. In an open letter to the community, the Scudder family, owner of Highline Cruises, said, quote, "We have markedly increased cleaning and especially sanitization efforts in our terminals and on our vessels. We instituted drastically reduced vessel capacities to afford those traveling with us the opportunity for recommended social distancing. In addition, we scaled back our number of departures to a level commensurate with efficient, essential travel only. Ridership on our vessels has been down more than 90% from the normal levels for this time of year. We are only averaging a daily total of 95 passengers on all 6 of our departures combined. Because of the pandemic and the measures we've taken to continue our service, even at the current reduced levels, we are operating with substantial losses daily. However, we do it because we are an integral part of the year-round public-private ferry transportation system to Nantucket. And we do it because many islanders have come to come to count on our service as an essential to their way of life." End quote. I would like to congratulate the Nantucket community on doing such a great job at social distancing. The hospital's COVID-19 tests confirmed the first case on island 21 days ago. If the community had carried on business as usual, this virus would have infected 2.5 people every 72 hours. At that rate, we would have had 400 people in the community sick within 30 days. About 25% of people with the virus will have no symptoms. They can easily and unknowingly infect many people. Even more have no symptoms in the beginning because of our community's sacrifices, chiefly social distancing. Our infection rate is dramatically lower. In fact, we're probably better than the 80th percentile, according to Gary Shaw, the CEO and president of the hospital. We have roughly a 0.08% infection rate, whereas the Cape has more than double that at 0.198%. The company, Unicast, which analyzes human mobility data with their team of engineers and PhDs, created scorecards for communities in terms of social distancing. Our island earned an A. Barnstable County has a B. In my conversation with my colleagues at the Cape and the Islands Health Agents Coalition, they were explicit when they say that they wish they had instituted strict social distancing guidelines as early as we did. They think if they had, they would have probably gotten ahead of the curve of the infection like Nantucket did. We must keep it up. If we don't, we run a significant risk of ruining our low rate of infection and seeing so many critical cases that the hospital becomes overwhelmed. A big challenge will come with the influx of visitors to the island in the warmer months. Currently, the Nantucket Board of Health is telling all people coming from off-island to quarantine for 14 days. That applies even if they were quarantined somewhere off-island. The Board of Health, along with state entities, are studying this matter to stay ahead of the curve. We don't know exactly when we shall return to our normal lifestyles, but it's not too late to consider what it might look like. In a public statement, Don Holdgate, chair of the Select Board, said the town is developing back-to-work plans for construction, landscaping, and restaurants that will contain safety measures and protocols for a gradual return to work. However, there are no plans to designate a start date. Shedding these intrusive restrictions will not happen all of a sudden. Rather, they will gradually dissipate. How will we know when this process can start? Well, the hospital and my team are looking for certain milestones in the metro areas along the coast of the Northeast, from where most of our visitors are coming from. When we see a peak in infection rates for those areas, followed then by a steep drop-off in deaths about 2 weeks afterwards, we will know the spread of the virus has begun to slow significantly. The most accurate way to analyze the presence of the virus on the island is with two types of tests. The first is the standard test, called PCR. That determines whether or not someone is currently infected. The second test, called an IgM antibody test, determines if someone had the virus in the past, but no longer does. Unfortunately, neither test is widely available. The good news is that the turnaround time for the PCR test has been reduced to about 24 hours, and the IgM test should be available in the next few weeks. Widespread testing is key to track how safe it is to reduce social distancing. Please note, the hospital is still offering testing to the public between 9 a.m. and 5 p.m. every day, except between noon and 1. The samples are sent out at 3 p.m. Therefore, for the quickest turnaround time, please come before then. To this end, the hospital has about 20 test kits for a machine called a Gene Expert System made by the company Safid. This device runs a molecular test on the sample to look for the presence of SARS-CoV-2, which is the official name of the virus. The hospital is not using these limited test kits for the public. They are saving them in case medical professionals or first responders need a timely diagnosis for themselves. The hospital is pursuing more test kits and expects to receive about 60 per month in the near future. In an address to the Select Board, Gary Shaw said, quote, "You may feel the bands of the hurricane have come past us. We've had some cases and we've seen a death. And we're a little bit in the eye of the hurricane. But the next side, the next 10 days, is really the defining period as to what it will look like. I believe it's going to be good, but it has to coincide with a decline in the death rate on the coast, or we'll end up with that disease transitioning back to us." End quote. What might an all clear look like? Tune in to next week's select board meeting to hear how the initial plans are looking. Gary Shaw hypothesized that in the future, restaurants might let a quarter of their occupancy dine in while continuing their takeout programs. Perhaps construction crews will be allowed to work with a skeleton staff. The town and state officials are starting to work on these ideas now. I would like to shift gears to talk about another important matter, the census. Despite the pressing matters of the pandemic, the future of Nantucket's funding and political representation depends on every Nantucketer filling out this census. Okay, so today we have Martha Turk, the administrator for the Nantucket's Complete Count Committee. Thank you for joining us today, Martha. How are you doing today?
I'm great. Nice to see you. Thanks for having me.
Nice to see you too. So really quick, we're just going to throw in a few questions here that are coming in from the public. We're just wondering about the census. Honestly, a lot of people are thinking that with the coronavirus pandemic, why are we still paying attention to this? What is so important?
The Census Bureau is on a schedule. They have a statutory obligation to report their findings to the other branches of government by the end of 2020. And so even though their operational calendar has changed a little bit, they can't delay it. So here we are. Here we are in the middle of a pandemic worrying about the census. But actually, it's not that big of a stretch. Census statistics are used to determine funding for municipalities for 10 years. And that funding supports services including hospitals and health clinics and emergency services and food assistance programs and schools and senior programs and infrastructure and housing assistance and all kinds of things. But a lot of these programs and services are things that we're relying on in the wake of COVID-19.
Further questions, if a person's not a citizen.
It's actually a fact. There's no citizenship question on the census. There was a lot of hubbub about that earlier in the year and last year, but there is no citizenship question. And there's a vast swath of Nantucket that does not have carrier delivery of mail. Unfortunately, that's the only way that the Census Bureau sends forms. And there's a period of time after they do that first mailing where they go out and actually hand deliver forms to houses that don't get mail delivered. But they can't do that right now. So all those people who are post office box holders have not gotten one thing from the Census Bureau. But really, it's very simple to just go online and enter your street address if you don't have a census ID. So there's a website at 2020census.gov. There's a big respond button, and it takes you through the questionnaire. And when you get to a point where they ask for a census ID, which is something that is on a form or on a letter that some people may have received, there's also another question that says, if you don't have a census ID, click here. And then you just enter your street address and you proceed. It's pretty easy.
Excellent. Well, one last question. If we've already filled out our census form, do I need to do it again?
Well, if you've already filled out a census form in 2020, the form you filled out is the Town of Nantucket's annual town census. And that's a completely different thing. This is a federal census, so I really encourage people to take 5 or 10 minutes at most, count everybody in your household, babies and grandparents and roommates and housemates and just everyone, because funding per person per year is somewhere around $2,400, and that's a lot of money when everyone gets counted.
Okay, well, that's great information. Martha Turk, the administrator for the Nantucket Complete Count Committee. We really appreciate you calling in today. Thank you so much.
Thanks very much for having me.
And now for a few questions from our audience. These questions came in through email at info@nctv18.org. First question is from Joseph. Can you release the age ranges for those afflicted? Is the ratio of those afflicted to the overall population considered a high number or a low number? Well, Joseph, the age ranges is from the youngest was about 23 and the oldest was 83. That is the age range on the island. And yes, our infection rate compared to our overall population is really low. It is a 0.08 infection rate for our population, which is very low. That's less than half of what Barnstable County is seeing. Our second question is from Keith. Curious to know why they aren't revealing the ages of confirmed cases anymore. It would be informative to get an understanding of the spread, and I don't think it violates HIPAA to reveal the age. Well, Keith, you are correct. It does not violate HIPAA to release ages. However, we were explicitly asked by Kevin Cranston at the Bureau of Infectious Diseases from the State Department of Public Health and Kelly Driscoll from the Executive Office of Human Services, Health and Human Services. We were explicitly asked by them to not release any demographic information, including specific ages for specific cases. Recently in other towns, and including some of our social media here, people who are being identified as COVID patients have been victims of bullying, victims of discrimination, and as a result of that, the State Department of Public Health has explicitly asked us not to release that information. The third question is from Jack. What is the status of the move to make masks required for any outside the home's trips? Well, we cannot require people to wear masks outside. Once again, it is a civil liberties issue. However, the CDC did come out with a recommendation on Friday that when you leave your home, please wear a mask. We are asking that that mask is one of the cloth masks that will not take away from the desperately needed surgical and N95 masks that the hospital needs. There's also ways to make your own. There are do-it-yourself masks that you can get. And these masks, the instructions on how to make these masks are available at the hospital's website. And the last question is from Bob. I'm starting to wonder if both Stop and Shop and Cumbies are essential. Could at least one group of employees be shifted out to reduce their risk of exposure? Bob, that's a very good question. The governor's order explicitly says grocery and convenience stores are essential and must remain open. With the most recent information on the occupancy limits, the State Department of Public Health, as well as the local health, believes that these occupational limits being limited to 40% of their occupancy numbers, is a reasonable number, and they can stay open. A lot of them have instituted very strict regimens. If you've noticed at Stop and Shop, the deli has been closed, and a lot of the meat and fish areas of the market have been closed as well. This is in response to these recommendations and to prevent infection from this. And if you notice that at Cumberland Farms as well, they have instituted the same occupancy limit, and there is no longer any self-service food items. Everything has been prepackaged and coffee is served by employees. So I believe that is all our questions for today, and I really appreciate everyone sending their information. If you have any questions, please email info@nctv18.org. And if you have a pressing question that you don't want answered before on live TV, but you still want answered immediately, you can contact us at health@nantucket-ma.gov. Now, let's move on to a segment we call Acts of Kindness. Nantucket Pulse wants to celebrate the creative and generous ways our community supports its members during this trying time. Aisha Khan and Allison Mitchell have organized a group that makes cloth face masks out of clothing. along with their team member and friend, Cindy Rodriguez. They also created some for the Nantucket Community Television crew, complete with the station's logo. Thank you very much, ladies. And now we have an interview with Aisha Khan and her colleague, Cindy Rodriguez. Where did the idea for this project come from? How did it come to form?
It's really started, my husband Nate and I have been watching the news closely, and we were following and seeing that masks and were becoming harder and harder to find at the lumberyard. And just because of his, he was diagnosed with cancer. So we've been very heightened and very aware of what track this has been taking in other countries. So we were just very, very closely following them. And we saw that there was a shortage, and then we wanted to create like a group or something where we could all maybe make the mask together. Nate and I just doing it alone, we wouldn't be able to ever accomplish what we can as a group. So we started a Facebook group, and that's where actually we met Cindy. Yeah. It was basically a group to allow us to share ideas, allow us to share material, allow us to say, okay, I'm out of elastic. What do you have? You're out of this. What do you have? And kind of say, do you need a machine? I have a machine. And that's kind of how it all began.
Wow. So you guys all just pooled resources. And Cindy, you found this off the Facebook group as well?
Yes, there's a Facebook group, and everyone's wonderful sharing their resources, what they have. And Aisha and Allison have done a great job of just kind of connecting us all. But like, I didn't have a machine, and someone lent me the machine, and now my husband also learned how to make the mask. So we're waiting for another machine, and we're just going to keep going.
That's great. How are people reacting when they receive their masks? What's been the response from the community?
Oh, it's been incredible. I've been lucky enough to give the mask to a lot of the people asking, and I will say I've cried so much this past 2-3 weeks, and it's not painful tears. It's just I'm so moved, and it literally will bring me to tears just to talk about it. We live in a really beautiful, beautiful community, and everyone's just been so nice and so gracious and so kind. And people are spending, their own time, their own money, their own effort to do this. I mean, we have a seamster and a seamstress who are not wanting to take money and making these and cranking them out. And we have moms who are staying up, after full days of work, homeschooling, and then, they're staying up till like 1 o'clock at night to make these masks for people. And they are just thinking about so many other people than themselves. I mean, even like Cindy, her boyfriend learned how to sew. Like, it's great just to be able to, help us all. And I mean, we've made masks for the hospital. So we still have members who are giving it to the hospital still. And then we started to think more frontline employees. So we are getting them to Cape Air. We are getting them to NRTA. We are getting them. I mean, anyone who's on the front lines, we're doing our best to get them there.
That's amazing.
Aisha, I think maybe that if anyone wants to join and anyone wants to help, please contact us on the Facebook page. People can help cutting fabric, cutting elastic. You don't even have to sew if you don't have a machine. And if you don't have a machine and you want to, we will find you a machine. We'll find you fabric, anything you need.
Yeah, we're still in it. I mean, our island home, Sherburne Cut, we're getting them there, but we are looking for sewers. And I mean, we can help you get started.
Excellent. Well, Aisha, Cindy, I really appreciate it. I know the community is really grateful for the work that you're doing. Keep up the good work, and we really appreciate it all. Thank you so much. And now for Nantucket's rumor report. We only have 3 rumors today. The first one will start federally. Does the hydroxychloroquine drug or treatment actually work on COVID-19? Well, the CDC is studying this information. It is definitely still a rumor that it is effective. We do not have enough data to confirm that or deny that. But there is some preliminary evidence that it is working on some patients, but not all. So we must keep an eye on all the information as it's coming out, and we will do our best to get that information out. And then as well, coming down to the state, there is questions about long-term and short-term rentals. So there has been a discussion about all rentals below 31 days being versus rentals more than 31 days. The state has defined any renting more than 31 days to be considered a long-term rental. That is allowed under the governor's orders. However, all short-term rentals, so less than 31 days, is not allowed under the governor's orders. And then lastly, there's questions about our local emergency orders. There's a rumor going around that the orders expired on April 6th. Though the original date on the orders was April 6th, there is a clause in all of the emergency orders that they will stay in effect for as long as the governor's emergency orders are in effect as well. The governor most recently expanded all of their orders and extended their orders to May 4th. Ours followed suit. Please pay attention to the Board of Health emergency order addendum, or the supplement number 1. That was voted in about approximately a week and a half ago. We will continue to provide you with updates on the coronavirus and impacts for Nantucket. This week, Nantucket Pulse debuted a wellness segment series hosted by Natalie Simonero with our local health professionals on Channel 18 and nctv18.org. Please share this with friends and family. It's designed to connect our viewers with local health professionals that can help us take care of ourselves and others around us. It's important that communications remain in place as events continue to unfold and we all remain connected. It's crucial to get the facts from your local news sources such as the Inquirer and Mirror, 97.7 AC-FM radio, and NCTV, Channel 18. I'm Roberto Santamaria, the Director of Health and Human Services for the town of Nantucket. Thank you.